Hi there, my name is Matt Doig. I'm Director and Founder of Innovative Practice, and I want to tell you a bit about the recall systems that I set up for practices. I've worked in general practice for over 10 years, 7 years as a practice manager, and then nearly 4 years now as a contractor working with various practices. And there are really common themes of problems that lots of practices find with regard to their recalls. These are some of the most common I've seen. So booking errors, patients booked in with the wrong nurse for the wrong length of time. Missed blood tests, so perhaps a patient's brought in for their diabetes review, but bloods that are needed for their medication aren't done at the same time, so a month later you bring them in again. Many practices have multiple different recalls for the same patient, perhaps for different conditions, different things that need monitoring. Maybe recalls aren't updated properly, and it's basically a really laborious way to waste a lot of time. You get wasted appointments. Perhaps you've got a full-time member of staff or even more than one whose sole job it is to try and work out who to bring in when, and they're going through patient records and so on. Lots of frustration, lots of wasted time. So I want to tell you about a better way. So some new principles we tend to work to. First of all, the idea is that all the reviews are brought together so that patients normally receive just one invite per year that will cover everything that they need doing. So that will be all their long-term condition reviews, all their drug monitoring, and other invites that things that might be done at the same time. Obviously, some patients will need more if they're on, say, methotrexate and need more frequent monitoring. That will be included too. It's based on clinical reports in System 1. The big advantage of that is that there's no manual setting up of recalls. You start a patient on a new medication and put it on repeat, and that medication needs monitoring, it'll automatically be picked up. Patients newly diagnosed with COPD, they'll then get a COPD review each year. New patient joins your practice, their records get transferred across, nothing needs doing, they will get the reviews done. And the third principle is that they're bespoke to your practice. Every practice is different. There are lots of things that are similar, but nurses and HCAs will have different skill sets. Practices have different clinical priorities, different ways they want to work. This isn't a off-the-shelf system, although we can offer that, but it's what your practice or your group, your PCN needs. So how does this system work in practice? Well, I'm going to take you through it with poor Mr. Mickey Mouse, who's got a lot of conditions that need review. So admin staff generate their invites in bulk. Tend to recommend doing letters first because you can put a lot more information in, and the letter's completely bespoke to each patient. So Mr. Mouse gets his invite. It lists the conditions that need review. A little reminder for him to bring inhalers because it's a COPD review as well. It reminds him things he's entitled to, like flu-vac, pneumococcal. Hopefully try and get those done at the same time while he's in the building. He's asked to bring a urine sample, and he's also given some questions to think about COPD. He could then also complete those online, or just scribble on a piece of paper and bring it in with him. So, Mr. Mouse has had his letter. If he doesn't respond, a few weeks later he'll drop into the next report to have a text reminder. When he calls up, the receptionist retrieves his record and sees this box here, giving them various options. Hopefully the most common one will be to book it now, but there's other options as well, like if they need to delay the review by a few months, they won't get any reminders until that time's gone. They can request a visit, they can decline the review. Anyway, let's say they click book now. It will tell them what free slot search to use. In the background, the system's worked out what conditions the patient's got, what reviews are needed, and therefore which slot search to use. So PN, practice nurse, 30 minutes. In some practices that might be a particular nurse, or you can configure the searches to work out exactly who that should be with. The staff then pick that from the drop down, and then it will show them all the available appointments over the next couple of months that meet that criteria. When they book from this screen, it will also take that duration, that 30 minutes will be carried through, so that that particular length is booked. I.e. they don't randomly go for 10 minutes, they don't randomly book it with the wrong person. It gets booked with the right person for the right length of time. And then there's a little reminder as well. Please ask the patient to bring a urine sample with them. So now the patient's booked in and they come for their review. You might have noticed that this dot's changed to pink, which shows that this is in progress, i.e. they've responded to the invite, they've booked it, so there's not going to be any more prompts to book them in again, there's not going to be any more reminders, it's in hand. And also they've got monitoring tests that are due. So the HCA or the nurse can see exactly what blood tests are needed. They can also see their blood pressure and urine samples needed. Poor Mr. Mouse has got a lot wrong with him, so a lot of different reviews are needed, although of course there'll be a lot of overlap. There's other things to consider, like shingles vac or flu vac, to do a drum, because this is a dispensing practice. All those sorts of information's there. You can see that the patient's got the appointment booked. You can see when they had the invite, and various other things. Basically all that you need to see to understand what's going on with the patient. Often you find patients says, well, why do I need these blood tests? Perhaps they're not used to being invited in for particular bloods, or the nurse or HCA is unsure. So here you can see exactly what's going on. So this patient's had 6 monthly PSA monitoring set up, and that'll get included as part of the system. No separate recall, no scheduled tasks. It will just get included. You can see what medications they're on and what the monitoring requirements are for those, and what conditions they've got, and again, those particular monitoring requirements. And the system works out, so these are the bloods needed for the annual review, i.e. bloods that have not been taken in the last 3 months and are needed annually, or anything that's due for whatever reason. The HCA can click a button to record all the bloods that have been taken, and that can be used to reconcile the bloods, make sure they're all back, contact the patient in bulk to say their bloods are normal, whatever it might be. You've got some quick options for really common things you probably do with every patient, like blood pressure. You've got links to particular templates like vaccinations. This is the adult vaccinations template that displays what's needed for flu, why they're eligible, things to consider, that sort of thing. And then you've also got the disease-specific templates. For this practice, this links to Ardens. Other practices might have their own, or other options available to them. And there they complete the review. They can tick to say it's been done. At the end of it, it can tell them if further appointments are needed. Some practices waiting on the results, so if the results are good, you might then write to the patient to say, actually everything's fine, no further actions needed. Other times you might say, actually results show that further conversations required. One final feature that can be really useful is the integration with medication reviews. Lots of practices find lots of tasks pinging around to review medications. Perhaps a task comes to you as a GP and you can see that actually they need the review, so forget it, you want that review being done first. So let's say in between booking his review and having the review, Mickey Mouse calls up for his meds, and some of them are past their due date, but he wants all of them. What the receptionist or prescription clerk can do is launch a protocol that tells them what to do. So it says issue one more script, and it gives the rationale, LTC pink, i.e. it's booked in, await completion of LTC review. And they can record it in the notes, and that will code it, put a free text entry to explain what they've done and why, and that's giving them the authorization to issue one more. Then when the review is complete and all the bloods are back, the patient can drop into a list to be reviewed by a GP or pharmacist or nurse to reauthorize the meds. So if people are on top of their work, actually the patient at no point gets refused their meds as long as they've been coming to their reviews, and the GP is not asked to review the meds until the review's been done and all the results are there. Anyway, that's about it for the system. So some of the big features you might have seen, the prompt for reception to book patients, directions for staff issuing meds, all your recalls put together, fully customized, and saving a lot of time. Most practices find that you go from almost a full-time job really, sending out these invites, to getting it down to a couple of hours a week, if even that really. So if you want to find out more, do get in touch. Happy to ask questions, happy to arrange meetings, demos, talk things through, and hope to hear from you soon. Thanks.